Okay, tell me more statistics about underage people drinking in different countries of the world, like the UK, Europe, etc.
Underage drinking is a big issue globally, with some stark differences. In the UK, about 50% of 15-year-olds have drunk alcohol, and 27% report binge drinking in the past month, based on 2018 WHO data. Girls in England and Scotland, especially at 13 and 15, are outpacing boys, with 40% of girls trying alcohol by 15. Europe as a whole sees 35% of adolescents, 15-19, engaging in heavy episodic drinking, led by countries like Denmark, where 15 to 19-year-old males average 4.4 drinks daily, and Luxembourg, topping the list for teen male drinkers. Southern Europe, like Italy and Spain, has lower binge drinking rates due to cultural norms favoring moderate drinking. In the US, 29% of teens, 15-19, report binge drinking, less than Europe, but still high. Canada mirrors the US at around 26%. Globally, the WHO's 2021-22 study of 280,000 kids across 44 countries found Great Britain has one of the worst rates, with early initiation by 13 more common than in France or Germany.
But how do
One
we estimate consumption? And what are some policies to limit consumption? Taxation, regulation and legislation, something else maybe?
Estimating underage alcohol consumption relies on surveys like the WHO's Health Behavior in School-Age Children study, where teens self-report drinking habits, though recall and honesty can skew results. Other methods include diary studies, where kids log drinks daily, or sales data analysis, adjusted for age demographics, but these miss informal sources like home supply. Policies to curb it include taxation, higher excise taxes on alcohol, like in Alaska, cut teen drinking by raising costs, with studies showing a 10% price hike drops youth consumption by 6 to 8%. Regulation enforces minimum drinking ages, 19 in the UK, 21 in the US, with stricter ID checks at shops and bars. Legislation, like zero tolerance laws for underage DUI, deters drinking. The UK's 2003 Licensing Act tightened venue rules. Community programs, like school-based education or parental supply bans, also help. Outlet density limits reduce access in some countries. Want details on any policy's impact or specific country approaches?
Explain to me minimum unit pricing.
Minimum unit pricing, MOP, sets a floor price per unit of pure alcohol, like 50p per unit in Scotland, to discourage cheap, high-strength drinks. It raises the cost of heavy drinking without hitting moderate consumers hard, targeting binge-prone teens and heavy drinkers. For example, a 10-unit bottle of wine can't sell below £5. Studies from Scotland since 2018 show MOP cut alcohol consumption by 6% among heavy drinkers, including some teens, by making cheap booze less affordable. Want more on its impact or where else it's used?
I want to go to our next topic, which is diarrhea. So, tell me the definition. So, it's the abnormal passage of loose or liquid stools, and it's more than 3 times a day.
Yeah, you nailed the basics. Diarrhea is defined as passing loose or liquid stools 3 or more times daily. It's usually a symptom, not a disease, caused by infections, food intolerances, medications, or conditions like IBS or Crohn's. Want me to dive into causes, treatments, or when it's a red flag?
Tell me about fecal
So,
incontinence and functional bowel disorders.
fecal incontinence is the involuntary loss of bowel control, leading to unintended leakage of stool. It can stem from weakened pelvic muscles, nerve damage, like from diabetes or childbirth, or conditions like diarrhea or constipation, overwhelming the rectum's control. Functional bowel disorders, like irritable bowel syndrome, IBS, or functional diarrhea, involve chronic gut symptoms without structural issues. IBS can cause diarrhea, constipation, or both, triggered by stress, diet, or gut-brain miscommunication, with no clear damage seen on tests. Both disrupt normal bowel function, but incontinence is about loss of control, while functional disorders focus on persistent symptoms like loose stools or pain. Want specifics on managing either or their overlap?
Please, yeah.
Managing fecal incontinence involves strengthening pelvic floor muscles with exercises like Kegels, guided by physical therapists, and dietary tweaks, high-fiber foods for bulk, or avoiding triggers like caffeine. Medications like loperamide can firm stools, and in severe cases, surgery like sphincter repair is an option. For functional bowel disorders like IBS or functional diarrhea, treatment focuses on symptom relief, dietary changes, low FODMAP diets, stress management like CBT or mindfulness, and meds like antispasmodics for pain or rifaximin for diarrhea. Overlap happens when IBS-related diarrhea worsens incontinence. Managing both means tackling diarrhea first with diet and meds, while training bowel control. Regular doctor check-ins are key. Want details on a specific treatment or lifestyle tips?
That's all good. Now, give us some idea now of some of the causes. Maybe they're parasitic, viral, bacterial.
Diarrhea's causes split into infectious and non-infectious. Parasitic causes include Giardia or Cryptosporidium, often from contaminated water, leading to prolonged watery stools. Viral culprits like norovirus or rotavirus spread through contact or food, causing sudden, intense diarrhea, often with vomiting. Bacteria causes like E. coli, Salmonella, or Campylobacter come from undercooked food or poor hygiene, triggering acute, sometimes bloody diarrhea. Non-infectious causes include food intolerances, lactose, gluten, medications like antibiotics, or chronic conditions like IBS or Crohn's. Want more on how these are diagnosed or treated?
Okay. And what about rotavirus, norovirus? Tell us about some viruses. Bacterial, like Salmonella. Parasitic, such as Cryptosporidium parvum.
Rotavirus hits kids hard, causing severe watery diarrhea, vomiting, and fever, spread through fecal-oral contact. Vaccines have cut its impact. Norovirus, the stomach flu, spreads via contaminated food, water, or surfaces, leading to explosive vomiting and diarrhea, usually resolving in 1-3 days. Salmonella, a bacterial infection from undercooked poultry or eggs, triggers diarrhea, fever, and cramps, lasting up to a week. Severe cases need antibiotics. Cryptosporidium parvum, a parasite from tainted water or pools, causes prolonged watery diarrhea. Tough to treat, but often self-limiting in healthy people. All spread easily, so hygiene is key. Want details on prevention or treatments for any of these?
I want to ask you about chronic liver disease now. What is it? And tell us about inflammation, fibrosis, cirrhosis too.
Chronic liver disease is long-term liver damage from causes like alcohol, hepatitis, or fatty liver, impairing its function over time. Inflammation, hepatitis, is the liver's response to injury, causing swelling and cell damage, often from viruses or toxins. Fibrosis is scarring. As the liver tries to heal, repeated damage thickens scars, stiffening the liver. Cirrhosis is end-stage fibrosis, where extensive scarring disrupts liver function, leading to jaundice, fluid buildup, or liver failure. Each stage worsens without treatment. Want causes, symptoms, or treatment options?
This is great. Okay. Now, let's talk about a normal liver, and then we'll slowly compare it with a liver that's going wrong.
A normal liver is a powerhouse. It detoxifies blood, metabolizes nutrients, stores glycogen, produces bile for digestion, and makes proteins like albumin for blood clotting. It's soft, reddish-brown, and regenerates well. When things go wrong, like in chronic liver disease, it faces inflammation from triggers like alcohol or hepatitis, causing swelling and cell damage. Persistent inflammation leads to fibrosis, where scar tissue replaces healthy cells, making the liver stiff and less efficient. If unchecked, it progresses to cirrhosis, with widespread scarring, a nodular, shrunken liver, and failing functions, poor detoxification, fluid buildup, and bleeding risks. Normal livers handle stress. Damaged ones lose resilience. Want specifics on symptoms or how to protect the liver?
So, let me ask you then about cirrhosis. So, what's cirrhosis? You said to me it's like scarring that worsens. And let's talk about how it relates with reduced metabolic capacity, portal hypertension, jaundice, impaired immune response.
Cirrhosis is advanced liver scarring, where healthy tissue is replaced by stiff, fibrous scar tissue, disrupting normal liver structure and function. Reduced metabolic capacity happens because scar tissue blocks the liver's ability to process nutrients, detoxify blood, or produce proteins like albumin, leading to fatigue and weight loss. Portal hypertension occurs when scarring obstructs blood flow through the liver, raising pressure in the portal vein, causing swollen veins, varices, that can bleed or lead to fluid buildup, ascites. Jaundice results from the liver's failure to clear bilirubin, a bile pigment, causing yellow skin and eyes. Impaired immune response comes from the liver's reduced production of immune proteins, making infections more likely. These complications show how cirrhosis cripples the liver's many roles. Want more on managing these issues or causes like alcohol or hepatitis?
Yeah, let's talk about alcohol and metabolic dysfunction associated steatotic liver disease. Fucking hell, that's a mouthful. And how they connect to cirrhosis, shall we?
Alcohol and metabolic dysfunction associated steatotic liver disease, MASLD, are major drivers of cirrhosis. Chronic heavy drinking, over 3-4 drinks daily for years, causes alcoholic liver disease, starting with fatty liver, then inflammation, alcoholic hepatitis, and eventually cirrhosis, where scar tissue replaces healthy liver cells. Alcohol directly damages hepatocytes, overwhelms detoxification, and triggers inflammation, speeding up scarring. MASLD, linked to obesity, diabetes, or high triglycerides, begins with fat buildup in the liver, steatosis, progressing to inflammation, steatohepatitis, and fibrosis if metabolic issues like insulin resistance persist. Both conditions reduce the liver's metabolic capacity, less nutrient processing, bile production, or detoxification, while scarring blocks blood flow, leading to portal hypertension and cirrhosis complications like jaundice or ascites. Quitting alcohol or managing metabolic factors can slow progression. Want specifics on prevention or treatment?
And we have decompensated and compensated, right?
Yeah, exactly. Compensated cirrhosis means the liver is heavily scarred but still functions enough to handle its jobs. No major symptoms like jaundice, ascites, or bleeding varices. Decompensated cirrhosis is when the liver can't keep up, leading to serious complications, fluid buildup, ascites, internal bleeding from varices, jaundice, or brain fog, hepatic encephalopathy. Decompensation often needs intensive treatment, like diuretics or even transplant evaluation. Want more on spotting these stages or managing them?
I see. Yeah, this all makes sense. Okay, let's talk a bit about hepatocytes and venous sinuses.
Hepatocytes are the liver's main cells, handling detox, protein synthesis, and bile production, making up about 80% of the liver. Sinusoids are tiny, porous blood vessels in the liver, where blood from the portal vein and hepatic artery mixes, letting hepatocytes process nutrients and toxins efficiently. In cirrhosis, damaged hepatocytes die, replaced by scar tissue, and sinusoids get blocked, hiking portal vein pressure and causing complications like ascites. Want more on how these changes drive liver failure or tests to check hepatocyte function?
No, that's so good. Okay. I want to ask you about varices, varices, and portal hypertension, splenomegaly, ascites, hepatic encephalopathy. How do these connect?
Varices, portal hypertension, splenomegaly, ascites, and hepatic encephalopathy are interconnected complications of cirrhosis. Portal hypertension starts when scar tissue in the liver blocks blood flow, raising pressure in the portal vein. This causes varices swollen veins, often in the esophagus or stomach, that can rupture and bleed dangerously. High portal pressure also backs up blood into the spleen, causing splenomegaly, enlarged spleen, which can lower platelet counts and increase bleeding risk. Ascites, fluid buildup in the abdomen, happens when portal hypertension and low liver protein productions, like albumin, disrupt fluid balance. Hepatic encephalopathy arises when the damaged liver fails to clear toxins like ammonia, affecting brain function and causing confusion or coma. They all stem from the liver's reduced function and blocked blood flow. Want details on treatments or warning signs?
Tell me about varices again. I don't understand what this is.
Varices are swollen, fragile veins, usually in the esophagus or stomach, caused by portal hypertension and cirrhosis. When scar tissue blocks liver blood flow, pressure builds in the portal vein, forcing blood into nearby veins, which stretch and bulge. These varices can rupture, causing severe internal bleeding, often signaled by vomiting blood or black stools. They're a serious complication, but meds like beta blockers or procedures like banding can prevent or treat them. Want more on how they're diagnosed or managed?
That's okay. Okay. What about jaundice? So, is there obstruction to the flow of bile?
Jaundice and cirrhosis happens when the liver can't process bilirubin, a yellow pigment from broken down red blood cells, causing it to build up in the blood and turn skin and eyes yellow. It's not always about bile flow obstruction. In cirrhosis, damaged hepatocytes fail to metabolize bilirubin properly, and scar tissue can disrupt bile ducts. If bile ducts are blocked, like in some liver diseases, bile backs up, worsening jaundice. Want more on other causes or how it's treated?
Yeah, how is it treated? Tell me
Treating
about
jaundice-
spider navy too, and like leukonychia.
All right, let's tackle spider navy and hyperbilirubinemia in the context of chronic liver
No,
disease.
spider navy and leukonychia, I said.
My apologies for the mix-up. Spider navy, also called spider angiomas, are small, red skin lesions with a central blood vessel and radiating legs, often seen in cirrhosis due to high estrogen levels from the liver's failure to break it down. They're common on the face, chest, or arms, and can fade with liver treatment or transplant. Leukonychia is white discoloration of the nails, often linked to low albumin levels in chronic liver disease, as the liver struggles to produce this protein, reflecting systemic issues like malnutrition or liver dysfunction. Both signal advanced liver damage. Hyperbilirubinemia, which you mentioned earlier, is elevated bilirubin in the blood, causing jaundice when the liver can't process it, often tied to cirrhosis or bile duct issues. Want more on managing these or their diagnostic role?
Yes, please.
For spider navy, management often focuses on treating the underlying liver disease, improving liver function through lifestyle changes, like avoiding alcohol, or medications for hepatitis can reduce their appearance. In severe cases, like cirrhosis needing a transplant, they may fade post-surgery. Cosmetic laser therapy can also zap them for appearance. Leukonychia treatment targets the liver dysfunction or malnutrition, causing low albumin. Nutritional support with high-protein diets or supplements helps, while managing cirrhosis with meds or procedures like TIPS can stabilize albumin production. Hyperbilirubinemia is managed by addressing its cause. In cirrhosis, stabilizing liver function with diuretics for fluid buildup or antivirals for hepatitis lowers bilirubin. If bile ducts are blocked, procedures like ERCP can clear them. Regular blood tests and imaging monitor progress. These signs are red flags, so doctors use them to gauge liver disease severity and guide treatment. Want specifics on tests like liver function panels or imaging used here?
Yeah, let's talk about routine liver tests and explain to me bilirubin and albumin and international normalized ratio.
Routine liver tests, often called liver function panels, check blood markers to assess liver health. Key ones include bilirubin, albumin, and INR, among others like ALT and AST for liver damage. Bilirubin, a yellow pigment from red blood cell breakdown. The liver processes it for excretion and bile. In cirrhosis, damaged hepatocytes or blocked bile ducts cause bilirubin to build up, leading to hyperbilirubinemia and jaundice. Normal total bilirubin is 0.1 to 1.2 milligrams per day. Higher levels signal liver dysfunction. Albumin, a protein made by the liver, vital for maintaining blood volume and transporting substances. In chronic liver disease, scar tissue reduces albumin production, dropping levels below the normal 3.5 to 5 grams per day. Low albumin causes fluid buildup, ascites, and can lead to leukonychia. International Normalized Ratio, INR, measures blood clotting time, reflecting the liver's production of clotting factors. Cirrhosis impairs this, prolonging clotting. Normal INR is 0.8 to 1.2. Higher indicates liver damage. It's critical for assessing bleeding risks, like with varices. These tests, often done every few months or as needed, help gauge liver function, track disease progression, and guide treatments like meds or dietary changes. Want more on how these fit into diagnosing cirrhosis or other liver issues?
That's so good.